Good morning, good afternoon, good evening, everyone. It's a pleasure to welcome you today in my capacity as a senior policy analyst leading a global portfolio of the G20 Global Innovation Hub. Today's webinar, Building High-Value Resilient Health System, Lessons from Climate and Other System Shocks, addresses one of the most pressing strategic questions facing governments worldwide: how we design health system that remains sustainable, high-performing, and equitable under increasing systemic pressure. Climate change is one of the most visible accelerators of that pressure, but it's not acting alone. Health systems today are navigating workforce shortages, demographic transition, infrastructure stress, and technological disruption. These factors are reshaping the risk environment in which health systems operate, and we are learning across G20 context and beyond is that resilience is not simply about emergency preparedness, it's about system design. It's about whether financing mechanisms reward outcomes or volume, whether governance structure enable coordination or fragmentation, whether data system support learning or inefficiencies, whether we continue to tolerate low value care that drains and weakness the adaptability. This is precisely why the high-value health system framework developed in collaboration with the Harvard Systems Innovation Lab is so relevant at this moment. High-value systems focus on outcomes that matter most to the people, optimize resource allocation, reduce low-value duplicative care, and align incentives across stakeholders. When these principles are embedded, resilience becomes a structural property of the system, not a reactive add-on. And sustainability becomes not just environmental, but operational and societal. Today's discussion builds on the 2024 policy report, Tomorrow's Health System Today, authored by Dr. David Bernstein, which uses climate-related pressure to eliminate broader system vulnerabilities and opportunities for transformation. Our goal is not only to disseminate findings, but to elevate the policy dialogue around actionable pathways toward high-value, resilient health systems. It's my pleasure to first introduce Dr. Sarah Al-Manif, Measurement Director at Valiant Health and Advisory Member representing the Kingdom of Saudi Arabia within the Global Hub membership. Dr. Sarah brings deep expertise in measurement frameworks, outcome evaluation, and performance benchmarking, areas that are foundational to operation value-based transformation. Measurement is often the bridge between strategy and implementation. Without it, resilience remains conceptual. Dr. Sarah, we are honored to have your perspective, particularly on how performance measurement enables sustainability and long-term system. Also, what our keynote speakers is David Bernstein. Dr. David is the author of Tomorrow's Health System Today and leading scholar in value-based healthcare and system transformation. Dr. Bernstein work spans clinical practice, policy reform, and global health system strategy. He has contributed to international dialogues, including the World Economic Forum and the National Academy of Medicine, and has authored transformation-focused reports across G20 contexts. Dr. David's work challenges us to rethink how incentives, financing, and delivery models can be redesigned to achieve both improved outcomes and financial sustainability. And we look forward to your insights today. And finally, we are joined by Lucas, Climate and Health Lead at the UK Government Foreign Office in Brazil. Lucas brings frontline humanitarian experience with UNICEF and deep expertise in cross-sector collaboration, extreme weather responses, and international health diplomacy, including UK-Brazil collaboration during the G20 process. His perspective bridge policy design and operational implementation, especially in aligning climate resilience with public health strategy. Welcome, Lucas. We look forward to your reflection from a governmental lens. Sarah, the mic is yours.
Thank you, Dr. Razan, and thank you, everyone. Good morning, good afternoon, good evening, wherever you are. And thank you to the Global Innovation Hub for improving value in health for convening this very important discussion. My name is Sarah Nif. As Razan mentioned, I'm the Saudi representative for the Global Innovation Hub as advisory committee. I've been there for a number of years now, and it's a privilege to join this webinar focusing on building high-value, resilient health systems, which is really important, particularly at this time when health systems around the world are really facing increasing complex and interconnected challenges, such as climate change, recovering from the pandemic, demographic transitions, economic pressures. And these are really systemic shocks that test the foundations of how health systems are designed, financed, and governed. The paper that frames today's discussion highlights a critical shift in thinking. Resilience and sustainability are not just separate goals from value. They are really essential components that make a health system truly high value. A high value health system is one that not only delivers better outcomes relative to the resources or cost in stable conditions, but it also needs to maintain performance, adapts, and continues to deliver outcomes during these periods of disruptions. This really reflects the broader definition of high-value health systems as those that achieve optimal outcomes through efficient and coordinated use of resources while remaining responsive to evolving population needs and system pressures. So from the Saudi perspective, resilience and sustainability are really central pillars of the health system transformation under the Vision 2030. Our national reforms are focused on transitioning from a volume-based model towards a value-based model, one that really emphasizes outcome measurements, population health management, strategic resource stewardship, which is a key structural enabler for this transition. And again, also one really key element is the establishment of a national public payer, the Center for National Health Insurance, which is responsible for strategic purchasing and aligning financing with value-based outcomes. At the same time, healthcare provision has been consolidated under the health holding company and the affiliated clusters, creating more of a clear separation between purchasing and provision. This separation between purchasing and provision is really critical to enable value-based healthcare and really allows financial decisions to be more explicitly linked to outcomes, quality, efficiency, rather than the volume of services. And so by kind of aligning these payment models with value and empowering providers to redesign care around population needs, this model supports continuous improvement, strengthens accountability for outcomes, enhances the system's ability to deliver sustainable value over time, even in the face of future shocks. We've looked at the importance of resilience during the COVID pandemic, which accelerated the adoption of digital health, strengthened care models, reinforced the importance of real-time data and outcome measurements, at least for us in Saudi Arabia. These capabilities are really essential, not only for improving value in health, but for enabling health systems to respond to emerging risks such as climate, environmental change. In parallel, we are advancing these collaborative initiatives across providers, payers, and policymakers to accelerate the implementation of value-based healthcare. These collaboratives in Saudi Arabia focus on measuring outcomes, identifying high-value models of care, supporting service transformation at the segment level, and by fostering a shared learning and aligning stakeholders around common value objectives and embedding outcome-driven improvement into routine practice, these efforts are strengthening the system's ability not only to deliver better outcomes today, but also to remain adaptable, coordinated, and resilient in the face of future health and environmental and systemic shocks. So in Saudi Arabia, we are increasingly integrating resilience into value-based transformation through a number of key approaches. First of all, strengthening outcome measurement systems, as mentioned, including PROMs and PREMs, to ensure we really understand and protect what really matters to patients. We're also aligning financing and purchasing mechanism with long-term value and sustainability. There's major investments in digital infrastructure and data integration to enable adaptive and coordinated responses. And we're embedding stewardship and system-level thinking into policy and institutional design. So ultimately, resilience is the outcome of international system design, and health systems that are built around measuring what matters and aligning incentives with outcomes and stewarding resources responsibility are not only more efficient, they are better prepared for uncertainty. They are also more capable of sustaining health systems gains over time. And this transformation is not only about improving efficiency and quality today, but also ensuring the health system remains adaptable and equitable and sustainable. I really look forward to today's discussion and to learning from Dr. Bernstein on this really important and milestone paper. Also from Mr. Lucas on their experience being shared. And as we collectively advance our efforts towards health systems that are not only higher in value, but are also really more resilient and sustainable for the future. Thank you. And with that, I hand over to Dr. David Bernstein to deliver his keynote speech.
Thank you very much. It's truly an honor and pleasure to be with everybody today. And good morning, good afternoon, good evening. Again, no matter where you are in the world, we're thrilled that you're here. And it's truly an honor and pleasure to be with my colleagues from across the world in Brazil and in the Kingdom of Saudi Arabia. So I'm going to share my screen and we can get going. Let's see. All right. So, can you see my screen? Let's see if thumbs up. Okay. Great. So again, welcome everybody. Thank you so much for having me here. And again, it was a pleasure and privilege to work with such great colleagues around the world to put this fantastic webinar together. Again, I'm just the guest, so all the credit goes to my colleagues in the Kingdom of Saudi Arabia. But it's my pleasure to present a little bit deeper look into building a high-value, resilient health system, and take a look at the lessons that we can get when we look at that from a climate and other system shock lens. And the reason I think that it's important to say kind of system shocks in general is we never really know what's going to happen around the corner, but health systems are designed to be there for populations, to ensure that populations remain healthy, are delivering on their promise to their citizens. And so it's really important that we take a broader overview look at how do we create a health system that is always going to be there no matter what may come around the corner. And so if we look at climate change and take climate change as the core shock, if you will, but we'll dig into a few others in a moment. Climate change and health and healthcare system sustainability are two global megatrends with broad human impact. As was touched upon briefly before, climate change is something that many governments around the world are grappling with. How do we address? How do we address these concerns? How do we take on this challenge head on, and to what degree, et cetera? But at the same time, health and healthcare systems are being stretched incredibly thinly. Delivering care to a growing aging population in most places in the world is putting a substantial strain on health systems everywhere. And at the same time, we don't really know, for example, what we're getting from a health standpoint. We typically don't measure what matters most to patients. We also don't really measure what it costs to deliver those outcomes to patients. In many situations, we have a budget and we spend it and we assume that the cost must be in the the ballpark of what we're spending, but what we spend and what the actual cost is of delivering that care are actually two very different measurements. And so at the same time that climate change and other system shocks are kind of rocking our economies at different unpredicted times, we have a health and healthcare sustainability problem that is really putting strain on a lot of the populations that our governments and our private sector serve. And so now we have these two major challenges that are really driving an issue and coming to an head that we really need to address. Also related to health and healthcare system sustainability, when it comes to that, it ends up being almost, if not universally, the #1 expenditure for governments is on health and healthcare. And yet we still don't have a solution. So all the work that's being done globally on trying to quote unquote fix healthcare, transform healthcare is critically important. And part of that is being resilient. And so as we go back to the slide here, if we look at climate change, it's not a small problem. It can negatively impact 3.3 to 3.6 billion people. It's one of the projections. And it can have not just a huge impact on individual lives, but if we take a step back and look at the economic productivity of our governments and of the world, it could decrease, GDP by 10 to 18%. And so that's just one example of a major shock. But if we look at health and healthcare system sustainability, again, we're spending more without a clear vision into what we are getting from a return on investment perspective. And then there's also risk of growing health disparities alongside all the other issues I mentioned. And so these two megatrends, these two major issues have historically been considered separately. And so if we look at that, they're much it's clear that they have some separate components, but I would argue that they actually have a much bigger interrelated component that has previously been understudied and underappreciated. And again, climate change is just one example of these system shocks. But again, if we look at climate change, there's been efforts to reduce our carbon footprint, address environmental impact and natural disasters, ensure economic competitiveness as part of climate change innovation. That's kind of been thought of as in a silo into how do we address the climate change and the issues that are around that to ensure our populations thrive. And then on the health and healthcare delivery sustainability side, there's been a growing effort to reducing cost. For all of those on this webinar, cost tends to be one of the #1 things that people always discuss. They say, oh, we're spending too much money on X. I would argue that reducing cost is important, but it's really the bigger question is not what do we spend, but what do we get for what we spend? But that's one of those things from a health and healthcare delivery sustainability standpoint that has always been thought of as a silo. How do we reduce costs? How do we improve health outcomes for a diverse population? Increasing NCDs is driving some of the challenges, and we have to address health disparities and inequities. And again, as shown on the screen, they've consistently been thought of as two separate megatrends that need dedicated teams and have been addressed in silos primarily. But again, these are more interrelated than often appreciated, and the health and well-being of a population and its workforce likely has a very strong overlap between climate change and the healthcare delivery that we seek. And at the same time, we can address things like novel pathogens and try to prevent them or manage them more efficiently and better head on. And so the report recommendation has three key recommendations. And to me, they highlight the tangible actions that can be taken. But importantly, and I think this is really importantly, they remain grounded in ensuring entry-level flexibility and authority. A lot of the times when we think about kind of solving some of these solutions, the recommendations or potential solutions may or may not be practicable in one context or another. And so creating a report that has recommendations that can be morphed and twisted to fit the individual context on the ground is incredibly important in order for us to really drive the change and the benefits that we want to see in the world. And so recommendation #1 is to build specific knowledge sharing coalitions to share best practices and avoid unnecessary failures. For those of you in healthcare, this is similar to sharing case studies, case reports of different patients or different conditions that we may see in the hospital, and think to ourselves, oh, if only I knew someone or somebody who I could ask who might have had a similar patient or similar condition that needed to be treated, maybe I wouldn't have had this issue, maybe I wouldn't have wasted these limited resources, maybe we would have had a better outcome up front. And it always seems that after the fact, we often, through kind of our root cause analyses and trying to think back of what we could have done differently, we realize that other colleagues around the world, around the corner, actually solved this problem, if you will, by themselves. And if only we had asked and had a structured way of sharing this information, we wouldn't have come across the same issue and had the same challenge. Recommendation number 2 is invest in accelerating and scaling a movement to drive efficient progress. Again, as I mentioned earlier, health and healthcare tends to be the #1 spend for almost every government in the world. And every government almost universally says health and healthcare delivery is a major challenge for our populations and for all of those that we serve. Yet, we haven't really seen this movement, this drive. There's kind of these pockets of, from a population level, there's these pockets of interest and these pockets of great work that are being on, but we really need to kind of come together and coalesce around a single movement, because when we think about movements, that's when real change happens. And you're starting to see it at country levels, and you're starting to see it grow, but we really need to invest in accelerating and scaling these movements. People realize that there's a major problem in these two major shocks, if you will, and other shocks that I'll touch on momentarily, and these two major megatrends. But what they don't necessarily realize is how important it is that we start addressing this now, that we are starting to spend more and more money, or continuing to spend, I should say, more and more money without a clear return on investment pitch. And so at the same time that we're investing more money and we don't have that clear return on investment from a health standpoint, at some point the system is going to collapse. And it feels like this is so far away to everyday individuals. And so if we can drive a movement that really emphasizes the relevance and the importance, and invest in that, then we can drive real progress in a much more efficient manner. And it's not just these little pockets of individuals doing fantastic work. And recommendation number 3 is we need to utilize international and national resources to design and implement system change at more a local level to reduce low-value care. And that builds a high-value health system that is prepared, responsive, and resilient against system shocks. And so again, we need kind of this international and national conversation, sharing of knowledge, the resources that are available from brilliant individuals who may be down the street, but maybe around the world. But we then need to take those learnings and develop solutions at the local context. One size fits all almost never universally works from a single organization or a single government to everybody, but the guiding philosophies, the guiding strategies, the expertise from around the world, we can take that expertise, take those international and national resources, and then empower people locally on the ground in order to drive the changes that create a high-value health system, like I mentioned, that's prepared, responsive, and resilient, and so that when there is a major shock, there isn't a major shock and a decline in population health and well-being, but a kind of steady state that it's resilient, and no matter what happens, the populations and those working in those systems are confident that the health system is going to continue to deliver on its promise to its citizens. And so the key is to build a high-value health system that absorb any high-value health systems that absorb any system shock and continue to deliver on their promise to their populations. And so climate change, as you can see here, is one example, but there's many. And part of the understanding around this concept is delivering the health system when you don't know what those system shocks will be. You don't know when they're going to come. You don't know the severity. We didn't know the COVID-19 global pandemic was going to be as severe as it was. Some of the climate change issues that arise, I'll give a good example. There was a major hurricane in the United States, and it destroyed one of the major producers of IV fluids in the United States, and it caused all of a sudden many hospitals and health systems to pull back on their delivery of key services unexpectedly. So we don't know when certain elements of a major shock are going to happen, but again, the population relies on delivery of excellent healthcare services to promote a population that remains healthy and is able to deliver on their economic agenda. And so climate change, again, is one example. A pandemic is another clear one that remains in our minds from the COVID-19 global pandemic. But there's always technology and cybersecurity issues. How do you address that? Again, the aging population in many, many countries around the world, not every country, but many of them. There's supply chain volatility that many of us have felt. There's geopolitical uncertainty, and there's always inflation concerns. And all of these may or may not happen again at some point. There may not be a major inflation crisis again. There may not be a technology or cybersecurity issue that we appreciate, but there always is that chance. And creating a system that's prepared to address this and not have their services derailed is critically important. And so for more details, I do point you to the report that's on the Global Innovation Hub for Improving Value in Health. And then there was also a perspective piece that promotes this report and highlights the key elements in a shorter commentary that was published by the National Academy of Medicine in the United States, the NAM Perspectives, that again highlights these key areas in creating a prepared, responsive, and resilient health system. And so for more information, those are certainly available. And again, thank you. This is my email address, and I'm happy to take questions at the end after my colleague Lucas speaks. And again, thank you to the fantastic team from the Value in Health and the Global Innovation Hub for putting this webinar together, and their leadership in trying to drive a better health system, both in the kingdom and around the world for everybody. Thank you. So now I'd like to pass it over to my colleague Lucas to continue the discussion.
Thanks, David. It's a really pleasure to be here, and I want to start my grateful comments saying that it is a really pleasure to get back to this contact with Dr. Razan, and I extend my gratitude to Abel, Dr. Rim, and the previous speakers and new colleagues, Dr. David and Dr. Sarah. So my name is Lucas Almeida. I was invited here to speak a little bit about the government partnerships and the government lens around the health systems and climate change. And we are in a very special moment between the UK and Brazil relationship. I'm representing the UK government here, but it's valuable to mention that I'm a Brazilian healthcare professional, so I can speak on both sides and to celebrate these partnerships that we are developing for the last couple of years. Historically, it's a good moment to share this in this panel. One thing to start first, and I want to be very clear with all the colleagues here, is that Brazil and the UK has a historical bond on the healthcare system. So Brazil has the Sistema Único de Saúde, or in English, the Brazilian Unified Health System, was created 35 years ago, inspired in the National Health Service of the UK. So Brazil adapted this universal healthcare system, having the partnership with the UK government years ago. And I'm very happy to say that these both systems are working with their unique challenges, as David said, about the realities and how we need to adapt these challenges for each population and each purpose. So when I speak about the main challenges of the NHS today, is that the NHS is under a 10-year reform to correspond to the new challenges that the global health agenda establishes. So the first thing that I want to share is that in this 10-year plan, the NHS is looking for a reform to bring more innovation, reduce the waiting lists, and also bring in the new features that can attend and assist their population the best way possible. Challenges that we face in the UK right now are related to the funding, because for the critics or the opposition, the amount of budget spent on the NHS is a lot, and it needs to be. It's impossible to run a universal health coverage health system without the proper budget. Second, this aspect of credibility. So for the last couple of years, the NHS has been criticized a lot in terms of infrastructure, lack of innovation, and the workforce raised their voice in terms of salaries and career plans. So this is all something taken into consideration for the new UK government to bring this innovation back in track. Things that we need to mention, the NHS right now is really open to learn from new experiences, and now is the way back. So the UK is requesting Brazil the lessons learned, and we are doing a lot of improvements. And at the end of my session, we'll share this practical example how the UK is adapting Brazilian solutions and vice versa and in their systems. I also want to share some information about the Brazilian Unified Health System, SUS, that is different in terms of size or population, but the challenges are the same because they're really close brothers, I can say. Fact number one, in the UK, the health insurance is mandatory. In Brazil, it's not. So SUS is responsible to cover 100% of the whole population in Brazil, and Brazil has a continental size. So 72% of the population of Brazil correspond to 158 million people relies on this healthcare public system. The challenges are common, so the underfund, the lack of innovation. But in Brazil, I want to flag one important thing about the health inequalities. So at the time that Brazil has a huge size, a continental size, the reallocation budget from the national and federal government is not equal to each part of Brazil. So you can have like very rich areas with very high-tech hospitals or primary healthcare units, but when you go to the frontiers with other South America countries, you have very single and very humble hospitals with not the same structure because there is this inequality budget reallocation. So as you can see, the NHS in the UK and SUS in Brazil have their similarities, but as David said, we need to adapt. We need to promote this knowledge sharing to bring something that Dr. Sada brought to us today about the resilience. So both systems are in different continents with different features for their population, but they're looking for these new methods to become new resilient health systems, okay? And last but not least, I want to mention the examples that I said minutes before about this government alliance, how the government can use policy levers to really collaborate domestically and internationally. So UK and Brazil pushed the climate and health agenda in the last 2 years, first with the D20 2024 in Brazil, where the UK and Brazil, plus the several other countries from the D20, and I'm so happy that the Kingdom of Saudi Arabia really active attended the D20 with us. We could reach some progress around climate and health, One Health approach, and specifically on antimicrobial resistance and vaccines. So several countries together in Rio to get their plans in the format of a declaration, being committed to work together for the next couple of years in these 4 specific areas. Something that is really important to us, Brazil and the UK are really pioneers or trailblazers in HNAPs, the Health National Adaptation Plans. So as a time that a lot of countries are adapting their new policies and even the facilities of their hospitals for the new climate change challenges, this Health National Adaptation Plans are the key tool promoted by the World Health Organization to prevent the climate disasters impact in different countries and continents. I hope to share later on the chat, if Dr. Razan allow me, I will link for the attach the Alliance for Transformative Action on Climate Change, created in the COP26 in Glasgow back in 2021. We have a lot of countries with us in this common goal of bringing more resilience and adapting the facilities of their healthcare system for primary healthcare units to remote areas where they have health teams attending. And last but not least, the experience that the UK is bringing from Brazil right now is the primary healthcare reform. So in Brazil, it's very common for us to have community health care workers, and I dedicated like half of my career to that as a clinician working for children. And right now in the UK, we are starting the first community health care official program, nationally funded by the federal budget, where we go door to door to do this in-person consultations, promoting family care, and doing the map of non-communicable disease and other preventable programs around vaccination to really promote the prevention in a country that struggles with aging, smoking, obesity, and all the other NCDs. So as you can see, it is a common goal of sharing experiences. The UK and the Brazil celebrated 200 years of diplomatic relations last year. And I'm very happy to be a health professional from Brazil working for the UK government and putting these countries to work together. Thank you.
Thank you to our speaker for framing both the conceptual and the operational dimension of this discussion. What would now like to do is move from a theory to policy translation, focusing on what governments and system leaders can do concretely to embed resilience through value-based transformation. So we'll take any questions from the audience. Please feel free to share your questions through the chats. I would like to start with a question for Dr. Sarah. Dr. Sarah, a measurement is foundation to value. From your perspective, and especially reflecting Saudi Arabia's engagement within the Global Hub membership, how can measurement systems be redesigned to capture resilience, not just performance? In other words, how do we ensure that what we measure incentivize long-term sustainability, prevention, and adaptability, rather than just a short-term volume or episodic efficiency?
Yeah, that's a great point. And we also keep on mentioning measure what matters, but I think we should not only focus on outcomes and efficiency and cost, but we should really focus on measuring clinical outcomes, continuity of essential services, stability of outcomes during these disruptions, some clinical outcomes such as speed of recovery after surgery or after interventions. This does require looking at it from an equity lens as well to ensure vulnerable populations are really protected. But also from a systems perspective, there are some indicators that kind of predict your adaptive capacity, such as workforce flexibility, digital readiness, supply chains, and these would really need to be incorporated in all of your measures to make sure you're measuring sustainability across a longer duration of time and to ensure your health system is protected against these shocks and to maintain outcomes, protect these access, to recover more quickly. So these metrics should be embedded into routine performance dashboards aligned with purchasing, accountability frameworks, and so on. So not just measuring patient-reported outcomes and cost, but also measuring these periodic and these continuous metrics.
Thank you, Dr. Sarah. I have another question for Dr. David. In the report, Tomorrow's Health System Today, you use climate pressures as a system stress test. From your analysis, how does climate stress reveal underlying structural inefficiencies in health system, and specific those related to incentivize misalignment and low value care? And perhaps more importantly, are we discovering that what appears to be climate vulnerability is in many cases, or value failure?
So it's a really, really good question, and thank you again for having me, Dr. Razan. So I think there's two components to this that we need to think about. One is the idea of climate and system shocks really reveal the fragility of a system and the lack of redundancy and circularity, meaning that when something happens, it shuts everything down. And I think if we just take that lens for a second and try to solve that problem, people will say, oh, well, that's low value because you're spending money on something that may or may not happen. I don't see the rewards immediately. That's a big challenge with health system transformation in general. In order to invest in such a system that is high value, you really need to invest in something that you may not see tomorrow, or you may not see in a week, or you may not reap the benefits of in a month. And so that is a perfect example of climate change, or other system shocks like inflation, or other kind of concerns that come up. Is redundancy has been thought of as a bad word, like, oh, it's redundant, we need to scrap it, it's a waste of funds, it's a waste of resources, it's causing us to invest in areas that may be low value. But we have to be more strategic about it. And so that gets to the second point. When you're strategic about these types of things, you can think about and say, okay, where do we really need these redundancies? And then where are they actually redundant and a waste? There's a difference between redundancy and waste. And as we start thinking about different scenarios and play out these scenarios, we can then have a better idea of saying, okay, this is going to allow us to better measure the outcomes that were previously mentioned and the outcomes most important to the system and to patients in a way that the redundancy supports that. And so we are prepared in case this, that, or something else that's completely unexpected happens. And so I think we need to take a step back from thinking that if we don't see the benefits today, it's a waste. And that if we don't have a system that is delivering on its promise for populations tomorrow, that is in itself a low value system. That if we are just really trying to catch up and run the marathon today in order to see patients only today, we're doing a disservice to the system overall, and we're not fixing the core aspects of being resilient. And then I see in the chat that someone had mentioned, is there a good example? And I appreciate that question. I think different places are doing different aspects of this well, but I can't point you to a fantastic example that tomorrow, if every system shock happened, this health system would survive. So I'll give a few examples. There's efforts underway, for example, in parts of Europe and in Asia, and in the United States on digital health. And now digital health is kind of like saying AI. Right? Like AI and digital health isn't a quote unquote solution. It's how you actually use it and think about it within this context that it can be a solution. So AI is a calculator, just like digital health can be a great tool or a terrible tool. And so the examples really are on how those instruments and tools are being embedded into care delivery so that if someone can't get to a clinic, they have access to care, which we saw during COVID-19. And so it's amazing how the health systems, for example, South Korea, those in a lot in Europe, are using these technologies to bridge divides of access to care that may not have been there before, or access to routine care for those that otherwise have to travel hours and hours. So that's an example to me of how we're adapting our system to be able to deliver the services and goods that people rely on in order to be and stay healthy.
Thank you, David. I have a questions to, one question for Lucas from a government and cross-sector lens. What are the most pressing vulnerabilities you are currently seeing, and whether climate-related, demographic, or geopolitical, and how they are reshaping national health priorities? And in practical governance terms, how do you reconcile political time horizons with the long-term investment cycle required for resilience?
Thanks, Dr. Razan. That's a really great question. I can share with the colleagues here two perspectives. The first one from the UK perspective, domestically, then the Brazil's domestically perspective, and then the both collaborations. So in the UK right now, climate change is really affecting the behavior of different epidemiological reports that we have nationally. So for example, when we have the heat waves are being more consistent and strong throughout the summer and in different seasons that were not supposed to be. And in terms of mosquito-borne disease and not the vector-borne disease are starting to get closer to the UK boundaries. So in Spain, France, and Italy, we're starting to have a disease like dengue. And this is really concerned because if we had like an outbreak of dengue in the UK right now, it would be one of this system shock that Dr. David just explained to us. So the main challenges in the UK right now is the behavior disease challenge or changes because of climate change. And in Brazil, it's a bit different. Despite the fact that we have a continental-sized country, the climate or natural disasters were not too common. But back in May 2024, we had huge unprecedented floodings in the state of Rio Grande do Sul in the South region. And it took just 4 days for this water of a barrage outbreak cause a completely damage in the health system. So 94% of the healthcare facilities were underwater in 4 days. So in Brazil, things are getting more intense in terms of extreme weather events. In the UK, the vector-borne diseases are changing their behavior. What we're trying to do right now is really to take this in consideration. And something that we're working in a government lens is called the situation rooms. Is this kind of practical example that we have. So right now in the UK, in Brazil, we have a collaboration between universities. So they work together, sharing data about potential climate change disasters and how the healthcare facilities can change their structure or even to shift their patients between facilities to reduce the damage of a potential disasters. We are doing and running some practical exercise considering the outbreak of dengue in 2024 as well, where we have 6,000 deaths caused by dengue here. And we see that the situation rooms will be a technology intervention that can predict and act as a warning system for both countries to be better prepared for the system shock. Okay, thank you.
Thank you, Lucas. So we'll get some questions. The other question for David. So the high-value health system framework developed with the Harvard System Innovation Lab emphasized measurable outcomes, optimized resource allocation, and reducing low-value care. In practical terms, what are the first 3 actions as a health system should take in the next 24 months to transition from reactive crisis management to proactive resilience building? Would you prioritize payment reform, measurement infrastructure, governance redesign, or primary care strengthening? Where does transformation realistically begin?
Yeah, again, a very good and important question. I think there's a few potential answers, but I think the 3 that I would argue for is 1, a robust system of measurement. Have data to drive your decisions, all your scenario planning, all of the ideas of what a system shock could or could not do, your supply chains, all of those aspects require good data and available data, and it actually supports the use of good digital health tools and AI. So a measurement infrastructure that is resilient itself to outside forces, to system concerns, et cetera, so that it can help you make data-driven decisions to make sure the health system remains resilient and help can deliver high-value care, both from a systems perspective, but also measuring the outcomes that matter, because those two things together is really how you get high-value care. So that would be my first thing. The second thing that I would do is really rethink kind of some of the scenario planning, but also related to that is try to break down the silos around where there's money and resources. If we think about it and take a step back for a second, there is a number of organizations or a number of business units within a company or a number of different settings where everybody's trying to tackle the same problem, but with little bits and pieces of the funds that are available. If we can try to break down those silos that are in the health system, that have been designed to be in the health system for a long, long time, and every system is designed perfectly to get the results it gets. So this is why we have this issue and the slowness of some of the change that's needed. If we can break down those systems and make it a strategic priority to integrate those systems and pool resources to address these problems across a health system, I think that's really, really key. So another actionable step is really looking at how we are structured currently to address problems related to shocks and take that and really try to reformat that and rethink that. And then the third thing is I do think that we need to invest in our workforce. That's a little bit of a different take potentially than others may have, but we are going to be short workforce in this world to deliver the goods and services needed to keep the population healthy. Now we have technology and other opportunities to bolster that workforce to make them work better and more efficient, but you need a workforce that is supported, feels supported, and it's delivering the care that they train to do. And when you cause people to work in a situation or a setting that is more stressful, that causes burnout, and doesn't allow them to operate at the top of their license, you're also creating a world where there's going to be less people who want to go into the healthcare workforce, and that in itself is going to lead to a system that doesn't deliver high value care, because you simply won't have the population in the workforce to deliver it. So we need to double down in workforce investment and training, starting very early, and rethink certain educational milestones and should medical school be the same number of years? Should training be the same number of years? If you work in a rural area, can you use certain technologies more? And how does that embed into training? Those are all aspects that I think we really need to focus on in order to drive a high value health system that's resilient.
Thank you, David. One more last question for Lucas. Embedding resilience requires policy lever. From your experience working across ministries and international collaboration, which levers are most catalysts? Is financing reform, workforce strategy, infrastructure modernization, or cross ministerial coordination? And how can governments ensure that resilience investments at the same time advance equity and value-based care, rather than just becoming parallel policy tracks?
Thank you, Dr. Razan. In terms of the policy levels, one thing that it is established between the UK government and Brazil government is that the climate change effects on health, it's a consensus between the health community. So right now we are expanding our requests and partnerships with other ministries to have some interministerial development work in both countries. So right now, the Ministry of Environment and Climate Change in Brazil is being very active and working really hard with us to really hurry or speed up this wake-up call that Dr. David said, that it is time to act now. And the Ministry of Environment and Climate Change in Brazil is huge. So right now we work in a collaboration with 4 different ministries. So the Ministry of Health, Environment and Climate Change, the Ministry of Science and Technology to help us with digitalization and AI, and of course, the Ministry of Finance. It needs to be something established in the federal government, then go to the subnationals and then to the municipalities. So we are trying to really recruit all these federal actors to give them the tools and the expertise analysis on health, that the climate change is a big piece for health. And we need to do this prevention work with the workforce increasement or continuing education, as Dr. David said. And in terms of how to keep it, the resilience strategies as a good move is something that we need to use the data, but also to show and to socialize the outcomes. For example, the NHS created the Greener NHS to replan and do the restructuring about the supply chain from medicines to the energy supply chain of hospitals. And right now we have a national report that shows the difference between acting or running a hospital in a very outdated or traditional way, and then thinking in a more sustainable, resilient health system, not just capable to respond for a health or shock system crisis, but also to reduce the economic loss or the investments and having a way better structured health system corresponded to the demands that we have today. Okay, so that's a couple of the work that we are doing right now. And we also are very open to discuss with other countries. And if you have any other doubts, I'll be glad to answer it. Thank you.
Thank you, Lucas, and thank you all our participants, and special thanks to our speakers for joining us today to this webinar. So what we are hearing clearly is that resilience is not a siloed reform, it's a systematic redesign. And today's discussion reinforced 5 strategic insights. Resilience is designed, not declared. Health systems do not become resilient because we call them resilient. They become resilient when incentives reward outcomes over volume, resources are allocated based on value, data informs continuous learning, and low value care is systematically reduced. Resilience is an architectural outcome of value-based design. Second, we've heard that when we speak about sustainability, we must think beyond environmental sustainability. We are speaking about workforce sustainability, infrastructure, social sustainability, and high-value system protect all of this. And also measurements. Without outcomes measurement, we cannot align incentives. Without cost transparency, we cannot optimize resources. And this is an area where collaboration through the G20 Global Innovation Hub becomes essentials and enabling shared learning across economies. And also for policymakers and stakeholders joining us today, the message is clear. Resilience cannot be built on top of inefficiencies. It must be built through transformation that requires political commitment, cross-ministerial collaboration, payment reform, strong measurement systems, and sustained global cooperation. The work ahead is complex, but it's attainable, and we continue our effort across the G20 and partners countries. Our commitment remains to advance high-value health system as the foundation for a resilient, sustainable, and equitable care delivery worldwide. So, on behalf of the Global Innovation Hub, I thank our speakers again, our partners, and all participants for contributing to this critical dialogue. We look forward to continuing this conversation through future policy dialogue and exchange, collaborative workshop, and implementation partnership. Together, I think we can move from resilience as a concept to resilience as a system reality. Please feel free to check our websites to read any of our publications, and follow us through the LinkedIn account to see our upcoming webinars and events. Thank you, and we wish you a productive reminders of your day. Take care, everyone.